Good evening, everybody. Thanks for coming. My name is Jen Barton. I am a POWER member. POWER stands for Portland Organizing to Win Economic Rights. Tonight we are here to talk about healthcare. And I want to let everybody know what POWER is. POWER is an anti-poverty grassroots organization that is led by poor and low-income people. We are united with everyone who carries this mission, and together we're building a local movement to win economic rights, end economic oppression, and abolish poverty. When we unite to claim our rights, together we have power. Tonight's public forum on healthcare justice is just one in a series of healthcare organizing that POWER is hosting to address the healthcare crisis that Maine is experiencing along with the rest of the nation. The forum is going to feature brief presentations from panelists here that will highlight the different aspects of the solution. It is our hope that participants that are here tonight and those of you who are watching this on public access will learn about single-payer healthcare and the ways that we can get there. Currently, the U.S. healthcare crisis runs deep and affects many, including the 47 million Americans who have been uninsured for a year or longer, and 33 million more who have been uninsured for 6 months. Also affected are millions who can't afford to use the health insurance they pay for, thanks for the high cost of deductibles and co-payments. Millions of our nation's seniors and disabled, for all intents and purposes, lost their prescription coverage recently, having fallen into the Medicare Part D's donut hole. Meanwhile, medical bills are now the #1 cause of U.S. bankruptcies. Since 1981 alone, such medical bankruptcies have increased more than 2,000%. Despite the fact that we have no national guaranteed health care, the United States spends far more than any other nation on earth on health care, nearly $2.2 trillion a year, or about 16% of our nation's gross domestic product. At the same time, when compared to these other industrialized nations, Americans are receiving far worse health outcomes by almost every measure, from infant mortality to life expectancy to overall quality of health. Before I introduce tonight's panelists, I'd just like to share a few of the basics about universal single-payer healthcare so that everyone is clear on what that term means when we are referring to it. For starters, universal means that healthcare is guaranteed to everybody and that all of us have the same comprehensive plan, including dental, any medical needs, eye care, all of that sort of thing. It also means that there would be no private insurance companies. Instead, the healthcare costs are publicly funded with no out-of-pocket expenses. Before I introduce the panelists, I also just want to say that there will be a question and answer time at the end. Please be respectful of the panelists that are speaking and no side conversations or interruption. You will have your time to speak at the end, and they will answer any questions that you have. So our first panelist is going to be Dave Wagner. He is a professor of social work and sociology. He coordinates the Master Social Work program at the University of Southern Maine and is the author of 6 books on issues of poverty and social welfare.
Thank you, Jen. I thought I too would start out with the idea of universal because the word is starting to be bandied about a lot, which I guess is a good thing, but it's also being bandied about by, I think, some groups that don't really have an intention of providing true universal health care. And the other issue I want to introduce, hopefully for the other panelists too, is why the U.S. is so alone, not only in health care, but actually in a variety of other social welfare benefits. We kind of stand out alone, or perhaps with Saudi Arabia and Singapore on a few of these measures. So first of all, universal. Universal has a really specific meaning, some of which Jen just touched on. The universal means that everyone has an entitlement for something at free or near free cost. And the big struggle in the 19th century, we often think, well, we have no universal benefits in the US. Actually, we do. One of them is public schools. And the big fight in the 19th century, it actually took the bigger part of the century to get free public schooling. If you go to the early 19th century, it was just the rich. They had to hire, you had to hire a tutor. And it was the early labor movement as well as other working class people who organized and got a public school system. And for all its deficiencies, no matter who you are, what your race, gender, location, you have access to public schools. We actually have a few other things, which again, we're so used to, we don't realize they're universal. Another struggle in the 19th century was to get free libraries. You sometimes see free public library, and that's because initially libraries you had to pay for. You had to be a subscriber, and not just a card, but you actually had to be one of the subscribers. Parks, police and safety, those are all universal benefits that we all have in the US. Now, of course, as I alluded to, compared to most other countries, we have very few universal benefits. One, as I'm sure you're all aware in this crowd, and probably people watching, particularly from SICO, is, of course, health benefits. But we also stand out, just to put this in a broader context, by the fact that every industrial country provides its people family or child allowances, which is a payment for each child, regardless of your income. And that's the case even in Australia and Britain, Canada, for example. France has quite an extensive system of family allowances. Paid maternity and paternity leave, that's paid. Sweden, for example, of 17 months paid paternity-maternity. Here you're lucky to get an unpaid paternity-maternity. Paid comprehensive daycare. In Sweden, the sliding scale is so low that I have a friend who's a professor who pays $5 a week for daycare. Pretty close to being universal. Free education through the college level. Sounds like a radical idea in the United States. They've had it around the world for a long time. In most countries, unemployment systems which cover a large part of your income. Germany, for example, 90%. So that if you're unemployed, you're not desperate to get the next job because you're getting 50% or in some cases less of your income. And finally, in some other countries, for example, France's constitution guarantees a right to housing, which is something we need to have here, I think. And other countries guarantee a right to a job. So many of these things which may sound radical here are not, even in other European countries, not to mention non-European countries. Now, this is not to say, of course, as most of us know, that there aren't some programs here. So what has been the United States' solution to providing anything at all in terms of health care or other social welfare? And they've been two. One is to give it only to poor people. And that technically is called the means test, meaning all your assets, income, are laid out in an application that's usually very stigmatizing. And if you qualify, you may get food stamps, welfare, Medicaid, Section 8 housing. There's a saying in social welfare that says, a means-tested program is a mean program. And the pun is very well taken, because to be on one of those programs, you get absolutely stigmatized, like in the old days, wearing a letter P on you. The other problem with means-tested programs, which I think we're all instinctively aware, is they're divisive. No matter where you set the means test, $5,000 a year, $10,000, $50,000 even, there's going to be people right above those lines who are going to be very angry at the people receiving benefits. So I think means testing, although it may have initially came from compassionate people who wanted to help the poor, has created a very divisive society which probably serves the people in power. To have people who are just above the line who say, oh, those people are getting all the benefits, versus people who are getting the benefits. So that's not a solution, I think. And the other one is we've created categories of people. Veterans, for example, the elderly in some cases who get benefits, Native Americans. Again, certainly I'm not saying both of these strategies are not better than nothing. But again, the problem is these programs tend to be divisive. Take Native American, the Bureau of Indian Affairs, which provides health care to Indians. These are programs that most people, if they know of it all, don't care about because it affects such a small percentage and stigmatized percentage of the public. Secondly, if you talk to people on the reservations and elsewhere, as soon as they can get out of the BIA system and get their own doctor, they do, because the quality of health care is also, generally speaking, lower in those places. So again, although both of those types of programs are often well-meaning, they really are no solution. They divide us, pit different groups against one another, and often, not always, but often provide poor quality of care. We see this with veterans, too. Here in Maine, for example, the situation at Togus and other places where the questions of quality come in for people who are waiting on long lines, who are part of the veteran system. So why does the US, the richest country in the world, have such a terrible system? And again, not only in healthcare, but really on a lot of these areas, child poverty, for example. And I'm going to give, I think, maybe a little bit different answer than many people give. I think there's a tendency, even among liberal circles, to get characterological or cultural with the US. We're rugged individualists, we're cheap, we're prejudiced, we're cowboys, we pull ourselves up by their own bootstraps. And, you know, some of those things may be true, but there's some real contradictions to those characterizations. One is that if you go back in history, some of those European countries had even worse social welfare systems than we did. I mean, England, if you think of Dickens, had workhouses all over the place. And you can go back not really all that long in history to find those countries had the same system. 1930 Sweden, you would find no difference between them and the US. Cuba till 1959, 1960. England, France, relatively recent. So if you're arguing characterological, it's kind of hard because after all, they were pretty similar, and in fact, those European countries settled us. I mean, it's not like we're, you know, white Caucasians have different genes. Those are the people who came here and stole the land fair and square. So I think the issue is really political and social. I think countries that have a free national health care system or other forms of social welfare got it in one of three ways. One is clearly social revolution, as occurred in countries like Cuba or Russia, in which the old system was overturned. They got it secondary in countries such as, for example, Sweden or Italy, in countries that had a strong labor party or a socialist party, and where confrontation got so great. For example, the early 1930s, Sweden had strikes across the whole country. And groups got together and said, now wait a second, we can't continue in this situation. Sweden, by the way, some people think Sweden's a socialist country. Think Volvo, Saab, Electrolux. It's not. But it has a very small number of large firms. So in a sense, they all got together much more easily and said, what can we do? And one of the things that comes out of that is a social welfare state, a compromise, if you will. Now, okay, you get national health care and so forth. And the third way, which is the case in countries like England, was the impact of the Great World War II. It had such a devastating impact in countries that people who ordinarily, I think, would not see each other as brothers and sisters and comrades felt were, you know, a country's destroyed. Britain was bombed, you know, just awfully. And so you get the Beveridge Report right after the war. And interestingly, Winston Churchill is thrown out of office and the Labour Party takes over. So where does that leave us? We certainly don't want a major war. We've got enough wars. But it seems to me that the statement by Frederick Douglass that power concedes nothing without a fight is probably still true. That it's probably going to take some sort of a social movement, at least akin to what we had in the 19th century with schools, to really get some sort of a universal healthcare system in this country. And I think we're also going to have an educated and informed public to demand a healthcare benefit, not only for all, but one that is free or close to being free. Because the premiums, I think, that people are going to have in mind when they do talk about extending health care are very much, a lot of the plans are going to be very prohibitive. And if I have enough time, I'll throw in one other word about taxes. That's the other line of defense Americans have. Well, it's going to cost too much. I may be getting into others' territory. But just briefly, if you turn out and do the math and add all your taxes, that include not just the federal tax, but state and local, property, excise, sales, I'm probably not even getting all. The difference really is actually quite small, and particularly if you take the situation of a working class person. Now, if you're very rich, it's true, most very rich people don't move to some of those countries with a high tax rate. But if you're a truck driver or a blue-collar worker, you're much better off being in those countries. You not only pay the taxes that are kind of equivalent, but then you get all the benefits I talked about. So, we'll probably get more into that later. I'll turn to the next person.
Thank you, Dave. Our next panelist is John Newton, who is a rank-and-file union activist, a leader with the AFGE Local 948, a member of the Southern Maine Labor Council, and a co-founder of the Maine Labor Group on Health. Take it away.
Thank you, Jen. Thanks to Paula for organizing this forum. I wanted to say a little bit about how single-payer healthcare works. Here's your card, health security card. You can take it anywhere. You can go to any doctor, any hospital, dentist. That's how it works. Any questions? It's simple. Everybody's got a right. If you're unemployed, you have the card. If you're working, if you're laid off, if you're traveling, if you're older and retired, and you get all the medical benefits, drugs. Oh, and maybe it doesn't cover cosmetic surgery that you don't really need. Why are unions particularly interested in single-payer universal health care? Well, union people for a long time, 100 years or more, have tried to do what's right and fair for people. So that's the most important aspect, that everybody should have a right to health security and universal single-payer health care. The other thing that's happening with working class people and unions is that no longer are we negotiating about wages, hours, working conditions. It's all about health care. And we're losing ground. Where people used to have, unions used to have coverage for everything. You know, we have deductibles and co-pays like everybody else. That's thousands of dollars now. In my case, I've paid $4,000 out of pocket this year, and I have a relatively good plan through my employer. And it's getting worse. When the nurses in Bangor, who have a union and were negotiating recently this fall, their employer said, the hospital, by 2010, our next contract, we may not offer health insurance. We may not cover your health insurance. Now that's quite amazing. The system is broken now, and it's getting worse. It's important, as Dave was saying, that we need a social movement to make change. And unions historically have brought us the weekend, the 8-hour day, Social Security. Now, we don't have an 8-hour day anymore, a lot of us. And Social Security isn't as good as it's supposed to be. And most of us work weekends. But anyway, those fights got us those benefits that we have. The other huge issue is retirement security. People have to keep working to keep their health benefits. They don't feel that they can retire. They can't economically. They have to keep working to keep their health insurance. So the big thing about universal single payer is that everybody's in and nobody's out. Now, how do we pay for this? There's a national bill. It's called the Connors Bill, HR House of Representatives 676, that proposes a universal health care system. And I did some calculations from my own situation today. You have to bear with me here. The Connors Bill, right now we all pay 1.45% Medicare tax. the Connors bill would increase that by 3.3% for us and our employer, which is a total of 4.75% tax on our income. So in my situation, I pay out of my check every 2 weeks for the year about $4,000. My employer pays about $8,000. And I pay out of pocket at least, and that doesn't count dental, another $4,000. So that's $16,000. My employer paying about half, and I'm paying another $8,000. And now that's a very good plan, incidentally. Most people are paying $10,000 to $12,000 a year for their health insurance. So if you do the math, I'm paying under the Connors system, the 4.75% tax, I'm now paying $3,800 a year. And so is my employer, instead of the total $16,000. So it's a cheaper system. And we're getting total coverage, and it's not a cost of doing business for the employer, so that we at the bargaining table can negotiate, for a big piece of wage that we couldn't before. Now, how does all this magic happen? Right now, the overhead for insurance companies is about 30%, and that includes all those people when you walk in, the billing people, all those people that you fight with about whether you're going to get coverage or not. Those people go away. The private insurance company goes away, unless you want to buy something for cosmetic surgery. So instead of that 30% cost, which includes their private insurance profits, maybe the system costs about 3%, which is what Medicare costs for administration now. Now, how do we get a system like this? Part of this is we need to listen to our own stories. There's a woman in Bath who works for a small auto workers local, or there's a union of mostly women there, and a new person was hired, but they don't get insurance for 6 months. Well, she died before she had health insurance. It's not acceptable. We need to identify who's responsible. Who's responsible for this kind of system that we live under? And the answer is the CEOs, the boards of directors, the wealthy people on these insurance companies. They're not only making a lot of money, they're responsible for decisions that insurance companies go and look at your record and find out that, maybe you've had some minor thing. And they say, we're not covering this major thing because you've had a previous condition. And other kinds of things. If you've seen the movie Sicko, and I recommend it, you've seen a lot of examples where people in the insurance business get paid to deny us claims. Those kinds of things are irresponsible, and we need to take these people on. And we're doing that. We have an opening now, almost like we did in 1992, where everybody's talking about health insurance, that there are 49 million people not covered. And the main AFL-CIO and other unions around the country are talking to our members one-on-one, and we're figuring out how we're going to be organized. And we're talking like this to our membership. And people like the Maine People's Alliance and Power are getting together and talking about how we can have a universal single-payer health system.
Thank you, John. Our next speaker is Richard Rames. He is an independent journalist, a columnist for the Journal Tribune, a dirt farmer in Biddeford, a member of both the National Writers Union and the National Farmers Union, and someone who has managed to survive the past 2 decades without health insurance.
Thank you, Jen. The introduction makes me sound more important than I am. Emphasis on dirt farmer. But I also suggested that I be labeled a democracy advocate, which I am. That's a tough row to hoe in a country like the United States, which frankly, in its founding documents, is opposed to democracy. You won't find democracy mentioned once in the Constitution because the sainted framers never intended that the people should rule this country. They believed in a plutocracy where the wealthy and slave owners, the people who lashed people for a living, were to prosper. That's still the country we have. The civilized world, the world that Dave Wagner was talking about, if you travel a lot, you may visit a civilized country. But in the end, if you come back here, you come to a different place. There are a number of markers, life expectancy, general prosperity, rights of women, rights of people regardless of race, that sort of thing. A lot of countries are way advanced compared to us, despite the hoo-ha that pours out and stains your carpet in your living room every night from the television. Anyway, one of the things I guess I'm supposed to talk about is the cost of the present system. It's roughly twice as expensive as civilized plans in the rest of the world. It succeeds in being twice as expensive while having disastrous outcomes in terms of life expectancy. And I've heard in the past that people from this country, from other countries come, and I've heard more than one anecdote about this where a U.S. citizen is driving somebody from another country around, and they're really sort of struck by driving down the street and seeing people who are obviously sick. Drive around Portland, drive around Biddeford sometime, the place where I live. Any urban center in the United States, you drive around, it's clear that the population is not well. Some people are very well. The people in the golden ghettos are just fine. But we are rapidly becoming a third world nation. Not because we don't spend a lot of money. The money doesn't get where it needs to go. And that's a democracy deficit. I was on the Biddeford City Council for a couple of years, and I had some folks on the council with me that we disagreed rather vehemently about economic issues and stuff like that. But I sponsored a single-payer resolution that went to Augusta. It was unanimously passed. Why was it unanimously passed? Because property taxes, which if you pick up the Portland Press Herald and other journals of opinion, you will see that they're always flogging this horse about property taxes. Well, one of the reasons that property taxes are high is because cities and towns have a lot of public employees. Because we're not totally uncivilized, they get, as part of their compensation package, a health care benefit. That costs money. It costs more every year. We're approaching double-digit inflation in the cost of health care premiums. Now, there are flat earthers that say, well, the solution is to just throw everybody over the side. We haven't gotten quite to that point yet. If we had a single-payer system, the numbers are very clear. The property tax bills all over the state would go down dramatically. Even reactionary people on Biddeford City Council, on city councils around, if they looked at it, they would see that it is eminently logical. Every town and city in the state of Maine ought to pass a resolution to the state legislature encouraging single payer. It would lower the cost of state government as well. The problem with the system we've got right now is it's privately held. It's a way of making money by not insuring sick people. The system is devoted to finding ways to throw sick people over the side and to socialize the cost of their health care. We have a system of privatized profit and socialized costs. That is the system that was designed by the framers. That's the system we still have. Dave talks about social movements and power conceding nothing without a demand, and that's all true. But I would suggest to you, frankly, that the older I get, and I'm getting pretty old, I'm coming to the conclusion that there's something about this country. There is stuff in the water, obviously, but it's not that. The problem that we've got, I believe, is our ancient constitution. The stuff that Dave talked about, these other countries, yeah, Britain went through a war, but we have, it's usually mentioned as a great accomplishment that we have the oldest constitution. The problem is we've got a pre-modern document that was put together by slaveholders. There aren't many constitutions like that. There have been democracy outbreaks all over the world. And people, when they got together, decided that, you know what? Free college education was a social good. Let's have that. Taking care of elderly people when they've made their contribution, their economic and social contribution to the society, they should live dignified lives. We can do that. Let's do that. Children, decent education, health care, daycare, right down the list, public transportation. We don't do much of any of that because we are living with a pre-modern constitutional document. We had a brief democracy outbreak in this country in the 1930s. And we had a president for life, Franklin Delano Roosevelt, who he had his problems, okay? But he was immensely popular, partly because he sort of brought the United States, despite its separation of powers and its checks and balances, the United States lurched forward towards something like a modern state. And the Republican Congress in the late 40s made a president for life now illegal. The Congress can still be elected for life. Strom Thurmond was, but the president can't be. I think that this comes down to a question of basic democracy, and I believe that it's going to take nothing short of a revolution to accomplish what most countries have accomplished just through ordinary political channels. We got a pre-modern document here. I apologize for getting it into this, but I do think we've got bigger problems than just organizing for single payer. I think there's something structural going on here. And I think the people who control this country are unlikely to be moved by entreaties and by social movements. They have more guns than ever, and they can sit back and wait. Elections are stolen easily in this country. I guess, one other thing. I see on my cheat sheet here that I should speak about how single payer is socialized medicine. It's not. It's socialized insurance. In the same way as Dave talked about, education has been to a great extent socialized, police and fire and all of that, roads, except for the turnpike, even that's quasi-socialized. Sidewalks, socialized sidewalks. I walked here on one tonight. What are we coming to, huh? Anyway, in Britain and other countries, they actually do have socialized medicine where the doctors actually work for the government. That's not what's being proposed with single payer. That's a socialized insurance system. The docs are still entrepreneurs and they get paid very well. They would have to form a union essentially and bargain for their wages. But they do pretty well in Canada. Canadian docs are big supporters of single payer. In Britain, it's a socialized system, and there is a national health service. Check out there was just a study done here within the last year or two. People in Britain, even correcting for demographics, so you're comparing middle class people to middle class people, life outcomes are better in England than they are here under a socialized medical system. I'm not arguing for that. We're a barbaric country. I guess maybe we all deserve to die young, right? I don't know. But single payer would be a nice halfway step, but I think it's going to take a revolution to get it. Thank you.
All right, thank you very much. So now is the time for questions and answers. And what we're going to ask is that people come up to this mic here with your question.
Well, I'll ask this question of all of you. If we agree with you, universal single payer is a good idea. What's the first step we should take to get there from here?
I'll go first. I think people need to act through their organizations. I think as atomized individuals, we get nowhere. Social movements that have gotten somewhere in this country, people got organized. And you need to be, power, low income, poverty groups need to be organized. Farmers need to be organized. Working people need to be organized. I think we all need to work within the organizations that we're in and develop planks, develop a program to put pressure on this hidebound political system. But as I said earlier, I think we also need to deepen our critique about what the problem is, because I think this is the elephant in the room that we have been very slow to recognize. Thank you.
Does anybody else have a response?
I think it's going to take some new tactics too. I don't really know what they are, or for me necessarily to say, but I think despite the fact that, as I said, universal healthcare is a little bit more out there in the political arena, I think without more pressure, it's not going to happen. And in one way, it would be so easy if everybody just didn't show their insurance card when they went into medical offices. If we could sort of organize something that would be a little different. But there's got to be pressure. I don't think it's going to happen just from one election or something of that sort. We need some new strategies, I think, to maybe this issue like schools and other things in our history will lead us to some that are nonviolent but that are effective.
I'll take a stab at that. First, I think we need to educate ourselves like we're doing here, like I've been doing the last few months. It isn't like single payer is a new idea. Some of us were working on it 50 years ago, not me, but some of us were working in 2001. You may have remembered there was a, quote, non-binding referendum for universal single payer healthcare in Portland. And so we need to raise those kinds of things again. That was instructive, that referendum. People like the Maine People's Alliance and other organizations, we spent about $25,000 on a non-binding referendum. Anthem Insurance spent, at least they reported, $400,000. They really spent $1 million because it's not about all the in-kind stuff. That's the kind of proportion, 25 versus $1 million. That's the kind of fight we're up against. So we need to understand that. I mean, they're not going to bring in single payer without a serious fight. There are organizations like POWER, Maine People's Alliance, Maine AFL-CIO, Southern Maine Labor Council, if you want to get involved, email, telephone, look in the phone book for one of those groups and find out how you can get involved. Because unless we have a social movement, the people in Washington, the people in Augusta, they may want to do the right thing, but they're not going to do the right thing unless we have a real movement. Now, I forget the year, maybe 2003, there was a study done by the Mathematica group that a universal single-payer system in Maine is economically feasible. And the vote in the Maine House and Senate, the House overwhelmingly passed it. And we lost just by a mere 2 votes in the Senate. So we can bring that again. This is a good time to do that. But we've got to be organized, and we've got to have representatives there that will do the right thing. But it's doable, so let's try to do it.
Could I take one more bite of the apple?
Sure.
I think the other thing that we might, talking about deepening the analysis, you may notice that we're having this discussion in a nonprofit media center. You may notice if you turn on your TV to all of the for-profit media outfits that are out there, and I'm including public broadcasting, you won't find anything like the discussion that we're having here tonight. That's for a reason. Because insurance companies won't pay to sponsor a thing like this. And I guess, the point that John makes about how we got close on a statewide single-payer system in the state of Maine, where did it die? It died in the Senate. And when back in 2001, it passed the House and the Senate, but it died at the executive level. We've got a checks and balances system. This is not a democratic system. Other countries have gotten this because they don't have the power of the population checked and balanced against itself.
I have 2 observations. The first is, though there may be a study that shows that it's feasible in a state, it's going to be very difficult for a state to do it alone. Support is going to have to come from the federal government. And having a president who supports single-payer health care is no guarantee of anything, but at least it gets a dialogue started. Bill Clinton came into office talking about single-payer health care, but quickly decided that he wanted his own popularity more than he wanted the issue. Dennis Kucinich is serious about single-payer health care. I think John mentioned the bill, the Connors bill, but Kucinich is a sponsor and helped draft that as well. Electing Kucinich is no guarantee of anything, but I think I can say that if people are not willing to take even a timid step of supporting a presidential candidate, and I would say the only presidential candidate who is for single-payer health care, they're not really serious about single-payer health care. The other observation I'd like to make is that the name of this country is the United States. And our government likes to talk about how the people are all united, but in fact what the government tries to do is, as has been described, divide us. And the people willingly go along with that. And if we really want to be a United States, what that means is that people take care of each other. That's what it means to be united. It doesn't mean we all stand around and watch each other suffer, or all stand around and watch each other die. If we want to be a United States, which is the name of our country, we need to be supporting programs that do unite us, recognize the common weaknesses that we as mortal human beings have, and aim to take care of them. Because until we're willing to take that step, the name of the country is part of the false advertising that's also being given to us in the form of our government rhetoric.
Universal health care will only lead us to a communist state. Just look at how universal health care has ruined England. Right now, England has a vast shortage of dentists. I don't know if you guys have seen that article in the Portland Press Herald a few weeks ago. And correction, we are a republic.
Well, one of the things that's happening, and this occurs in every political debate, is the media is using the fact that some of these countries that I mentioned have been cutting severely their social benefits. I mean, Britain has been cutting its National Health Service for about more than 20 years since Thatcher took over. So it's very hard in some debate. People will come up with stuff, but this is true now in Canada as well, that are a little complicated. The provinces are in different places now in Canada. So this battle is actually being refought in some of the countries, you know, in terms of stopping cuts to services. And that leads me to something that maybe we'll get back to. I think we have to bring down costs. You know, in John's analysis of how much money that would have to be spent, that didn't sound that great to me. I think one of the problems we have is you could have the same operation in France, much less in Cuba or something, and pay 1/3 of what it costs here. And a lot of that, yes, is the profit, you know, is the for-profit companies. But I think somewhere along the line, if we could ever get the cost socialized, the government would have to bargain and press down costs. Doctors just are not going to make what they're making now. And probably not only doctors, but other providers that are making a fortune on healthcare. Because if we don't deal with that, there's no way that the government's going to be able to pay. And that's been part of the crisis occurring in some other countries too. Canada has some of that because it's so near us. And, you know, I mean, not even just healthcare, talk about mental health care. I mean, you know, if you got a psychiatrist charging $185 an hour, who's going to pay for that? I mean, other countries don't have that kind of system. So I think that's also got to be in the discussion somewhere. It's, you know, it's sort of inconvenient sometimes to deal with that, but we've got to do something about the providers that are making all the money in this, as well as John said, the insurance companies and the CEOs and so forth. They're kind of all got a little stake in all this.
And I mean, that's I tried to sort of take a shot at some of that, mentioning the way the system works in Canada, where the docs basically bargain. They have a de facto union or organization where they get together. There's a pot of money. It's called a global budget. And under single payer, because there's one payer and everybody's in and nobody's out, you can get your arms around hospital costs and technology costs and costs for professional services and all of that, and you essentially decide how much is going to be necessary to budget, and then people live within those budgets. That doesn't mean that physicians or MRI operators are dumpster diving. That doesn't happen. Okay? People still live good, civilized lives as they do in the rest of the world, providing important services for people. But once you have your arms around that problem, then it becomes much easier to do the cost containment. And once you begin to think about that, it's very obvious why that should be the case. There's no way to get your arms around the costs here in this country under this balkanized system that's based on a few people getting very, very wealthy and a lot of people getting sick and dying. Anyway, if we had a democratic media system, we could have a show about that every night, but we don't, so.
I've got a question that's could be for everyone in the room, but I'm primarily going to focus it at the union folks. How is it that you expect to get HR 676 passed unless you also support the one presidential candidate that co-wrote the bill? I continually hear that unions across the country are coming out in support of HR 676, and yet they're not loudly saying, and we're also endorsing Dennis Kucinich for president. And my take is, you're not going to get the bill unless you get the guy. So I would like to know, why is it that the unions in Maine aren't saying, Dennis is our man, saying it loudly, and saying, put it on the front page of every newspaper in the state?
Certainly there are individuals, supporters of Dennis Kucinich. and I certainly supported him in the last election. I think what we understand is we need a movement strong enough that all the candidates are going to be for universal single-payer health care. And they're talking universal, but if you just hear universal, then you want to ask what they're talking about. Because then if they don't mention single-payer, they probably aren't. I understand your passion about a candidate. I mean, we need to do a lot in this election that's coming up. And we need to get all the candidates talking about health care, health security, and hopefully we'll have single payer on the agenda for discussion too.
I think all of us are union people. Dave, you in a union? Yeah, I'm in a union. You know, I was a Kucinich delegate last time, but you know, it partly gets back to this political analysis that I was trying to talk about before. As John says, we've got real problems here because we've got the people's power is split any number of different ways. Even if we were to get the Senate, the bastion of the wealthy, to go along, and we were to get the House of Representatives to go along, and our current, I don't think either one of our congressional reps at this point actually are out in favor of single payer. But even if you got that, and you got the president, not an easy task, because they need to raise money in order to get elected, and they get that from insurance companies. The Supreme Court might very well rule that it's unconstitutional. Okay? The popular power is checked and balanced against itself in this country. That's why I was saying we've got serious problems here. If I'm still in the Democratic Party, come time to be a delegate for Kucinich, I will be a delegate for Kucinich. But, you know, this is we have a wealth primary system here. The so-called serious candidates and our for-profit media system judges and rates electoral candidates based on how much money they raise. And you can't be for the people and raise a lot of money. It doesn't work like that. You have to be for the corporations in order to raise money. And all of the serious candidates, I hope I'm not shocking anybody here, are for the corporations. That's the system we've got. I think it behooves adults. This is as I get older, I get a little more testy, because I think it's high time that we had an informed and adult discussion about the problems that we have in this country. And yes, we have problems in this country. And they're not spelled Michael Vick or Britney Spears. We've got serious problems, and we need to start looking at them and wonder why we're so far behind the rest of the world, except when it comes to ways of blowing people up and killing them.
Mm-hmm. Yeah, Rich is right. It must be something about getting old. I'm getting testy too. And I guess because every 4 years, there's a little bit of excitement for a little while. You have Fred Harris, I'm old enough to remember. You have somebody who's going to run for a short time, is not going to win, and then I see most of my friends say, we're going to vote for the Democrat. Now, the Democrat doesn't usually stand for anything all that much different than the Republican, but they've gotten themselves so worked up from the primaries, which, by the way, I think is the intent of the whole system, that they go, okay, I'll vote for Clinton, Bill or Hillary, take your pick. And there's also a serious error in Sicko. Hillary Clinton, Bill Clinton were never for single-payer health care.
Right.
And he ran and he said he wasn't. And yet people said, oh, well, I heard something about health care. And in fact, Clinton's 1993 proposal was probably the worst of all worlds. Right. It was a corporatist health care system, which would have put the biggest corporations, the biggest insurance corporation would have managed, if anybody remembers, back to 1993. So I do like, I do like Ruth saying we've got to look honestly at the way the system works. And the way the system works is really going to be absorb people as much as possible. Get you in July to come out and say, all right, the nominee was so-and-so, who we really don't like that much, but he or she is going to be better than what the Republicans can. And we go through that every few years. And so I'd say, how about an independent party?
A Labor Party.
You were talking so much about that it's the system, not just the healthcare, but I think the system is a huge problem, and sometimes we get there by working on different issues, whether it's healthcare or something else. So our time isn't wasted, and you went from there. You were talking strategy, and I just wanted to add on. The numbers, the data, the costs of what we're doing now in healthcare are so absolutely shocking. If people could get more creative in 50 ways to just keep making the public aware of this, and there are creative ways to, get people conscious of what's happening. I think we need to change the debate. We're talking about how to get health care for everybody, and tonight's the first time I've heard anybody say healthcare costs too much. If healthcare didn't cost so much, more people might have healthcare. And every time I listen to it, I get so exasperated. And the other thing I wanted to say is I get my annual mailing of why I shouldn't have Medicare, but why I should have some other private coverage that is going to cost me $100 a month less than Medicare. And the reason is because our taxes are subsidizing the private companies to give us health insurance. They're trying to destroy Medicare. And it's really critical to be aware of this, and it's something I would be willing to work on. The AARP, Association of Retired People, actually in their bulletin said that the private, they're called Medicare Advantage for anybody who's following it, that they're being overpaid 12%, whatever that all means. But AARP has one. So I called them up and I said, you're competing with yourself and you're hurting me. But we need to do whatever we can to make people more aware of some of the absurdities of these things.
One of the latest scares that the people who want to drive the United States back to the 19th century and get rid of Social Security, there are a number of gambits that they've used over time. Baby boomers are the problem. Now they're sort of lumping the baby boomers and Medicare, Medicaid into the equation, and the number that they're using is that, I mean, it's puffed. It's not exactly right, but they're saying that in 10 or 20 years that Medicare and Medicaid alone will be something like 20% of GDP. Okay. I think that's a little high based on people that I trust who understand numbers better than I do. But that's just Medicare and Medicaid. Okay, then you've got the whole private system, below that. The only thing that gives me any hope at all, given this cancerous system that we have, yes, I'll use the metaphor, is that the system is simply running out of gas. It is so illogical and inefficient that it's going to be like, healthcare may be the only thing well, of course we've got to have bombs, but medical care and bombs may be the only thing that the United States, sporting events. Medicare, bombs, and sporting events may be the only thing in the U.S. economy in another 20 years. It is simply untenable. And to echo a point that Dave made about Clinton, there's been this tremendous rewriting of history. Anybody who was paying attention when Bill Clinton was in office understands that Bill Clinton was no friend of single payer. And I remember, if you remember that when Clinton first got elected, he had these roundtables with corporate executives, and one of the lines that they used about how unsustainable the present system was because, for instance, U.S. automakers were spending more for healthcare than they were spending for steel. That was one of the lines that came out that sort of stuck. Well, I watched one of those things, and I heard Bill Clinton say that we don't want to have healthcare in the United States in the public sector because then people would be able to vote themselves better healthcare. This is
God
how
forbid.
Nobody laughed. Nobody shrieked, okay? But he was talking to corporate executives, and it was on C-SPAN or something, so nobody was watching. But, this is how garish this guy was, all right? He is still being lionized, except by the extreme right wing, as sort of a take-charge guy and a statesman. He had his finger on something, though. If you allow people to vote themselves a better life, they will. Okay? The wisdom of the framers reigns supreme. We never get the chance. Thank you.
I'd like to speak to what we can do. It's important that we understand that it's not an easy task to get universal single-payer health care. But we need to believe we can do it. And that takes educating ourselves. That takes people in this room and at home thinking about it, talking about it. We need to talk to each other about it. We can have a referendum in this state sometime where it's on the ballot, and just like in Portland, our $25,000 can beat $1 million because we can vote it in, and it'll be a continual struggle. It's a struggle. It's been a struggle to maintain organizations in this room, maintain Dirigo, and when Dirigo came on board, 2003, I think. The promise was it was going to cover everybody. Well, it's been a failure. That system, that idea that you can sort of patchwork it together, that's important. I mean, Dirigo's important. My son was one of the last people to sign up in June. So I'm happy he's got coverage, and I'm happy those thousands of people do. But, we've got thousands of people don't, and we've got a system that you don't have this card where you can walk in and get what you need. And we can do this, but we have to talk to each other, and we have to join organizations that are working on this. And that's why the AFL-CIO is going around to every union, leaders like myself, to every union in Maine, and talking about it. And people are responding because it's such a system that we're all losing coverage. We all are insecure about a lot of things, but about this health system. And we want to change that. And the only way to do it is to work together.
Yeah, I think there's a lot of questions of strategies and tactics, as well as John says, educating ourselves. I think there also needs more communication between different groups. For example, one question on a statewide referendum is, even if polls show it up by 70%, they're going to spend a fortune. I mean, if you had a statewide referendum, the insurance companies would throw millions of dollars after that. And I'm not so sure, it sounds like a pessimist, I'm not so sure at the end of the day, back if you remember the, Harry and Louise, commercials. If people are inundated with enough of those images, that necessarily will carry the day. It can go from a 75% margin to 48% at the end of the day. So I don't know. I'm not against it. I'm just saying it's something that really has to be talked about a lot. The other problem we have, to be honest, is we don't have a lot of members in those groups. And the AFL-CIO in 1950 represented 32% of the workers. It now represents in Maine like 10% of the workers. And it doesn't always have access to its members either. So simply saying, okay, there's ABC organization, how many people are mobilized around anything? How do we get people in this era of, everyone's home on their computer and iPods and everything else? How do we get people actually doing something? I don't know the answer to that. I'd sell it or something, but I think that it's a real problem. I think we can't just say, well, we have these organizations. So the organizations, their numbers, a lot of them have gone down. For a whole lot of reasons. So those things need to be, maybe today's not the time, but need to be discussed among people who are active. How do you revive these organizations?
And I guess I would add in line with that, there is this David and Goliath syndrome. The initiative and referendum is something that we have in the state of Maine largely through organizing. Labor was key among the groups that got initiative and referendum. I think we're one of something like 22 states in the country that have initiative and referendum. They've tried single-payer referendums in California, and the healthcare industry just mobilizes, throws tons of money at it. When they get the signatures, a public opinion is running 70% in favor, and after the corporations get done lying and fear-mongering, the corporations get the vote. In a simpler time in this country, and I've sort of lashed, the framers, okay? But in the early days of this country, as Richard Grossman and Peter Kellman in the Program on Corporations, the Law and Democracy have pointed out, you look at the record, and up through the middle part of the 19th century, corporations were understood to be creatures of the state, were chartered by the state for particular works. They were not recognized as people. They could not speak. They could not vote with their dollars. They could not mobilize public opinion. They were subordinate entities. We could vote. People are citizens. Not these corporate fictions, not these legal bastard children of the political class. And in a system where only people voted and where only people spoke, I think we'd have a chance, because I continue to believe that the population is for all kinds of wonderful things. Free post-secondary education and childcare and public transportation and all the things that make the world civilized. And in a rich country like ours, yes, it's still pretty rich, we could have all of those things if people could actually vote to improve their lives. But as long as we have corporate personhood standing there propagandizing us and controlling the flow of information over media, it's unlikely that the population will ever get a chance to have those votes.
Okay, we have time for one more question, if there is one more question.
You guys want nothing but to destroy this great country of ours by leading us into a communist nation, which we already are headed into. And you guys say universal healthcare would be a good thing because it would provide free healthcare to everybody. Well, everything's already provided for free. Let's give them everything for free. Let's give them more free food, more free Social Security. That comes out of people's pockets. I see no solution from you guys.
Well, there was this thing called the Universal Declaration of Human Rights, and there have been succeeding laws and policies put in place in the civilized world. And the idea of the Universal Declaration of Human Rights, which was actually born here in the United States, was that that the measure of civilization is that sort of the core building blocks of a free and open society should just be guaranteed. And the world is wealthy enough. We have a lot of machines. It's a lot. We have made tremendous economic advances. And the question is, who benefits from those advances? That is a core question of democracy. I don't know where it all leads. I know I'm in favor of democracy. Let people vote.
I think there's understandably we feel somewhat powerless and cynical, and that's a difficult thing in our society to overcome. I think we all deal with it daily. I do see some changes happening. A small example in my life is the Southern Maine Labor Council, that is a coalition of union people that lead their local union, probably 15,000 people in Southern Maine they represent. 2 or 3 years ago, We used to have a half a dozen, 7 or 8 people, and we talked and did sort of routine business kinds of things. Helping the post office, the postal workers collect food for Thanksgiving, that they all come around to your doorstep. But things have changed in the last 2 years there, and that's why I'm optimistic. I mean, it's not, and it's real, because I think people that represent a larger group of people, so that they feel like they have some power, that we come together and talk about what it is that we can do. And I don't know why that organization is stronger now. Some of it's the leadership we have in some of the officers. A lot of it is a lot of women involved from other unions, and we set up a constitution where half our board is women and half men. And we're mobilizing, and I haven't seen us do that in a while. If you had asked me in 1968, would we have more institutions? Would we have universal health care? Would we have good retirement for everybody? Would we have no unemployment? I'd say, we could have a society like that. Well, I'm not going to see all that in my lifetime, probably. But I think we need hope. I'm telling you that we can have a universal single-payer system. But we need to get serious with ourselves, each other, about talking about it and getting active.
I think it's good to raise the issue of free health care and free college education and some of these other things. I think at a minimum, you get people to think, why do you have to pay for your basic needs? And after all, as humans, we live for thousands of years without charging. Now people sell air rights, right? But if you think of Native Americans, also other indigenous peoples throughout the world, you didn't pay for everything. I think we, I say we, people who are activists in this, really should throw that out, Again, why is it that other countries have relatively free healthcare or free college or all these things? Let people think about that. Rather than view, I think one of the things the media has done to us, as Rich alluded to, is I think people very much, even ordinary people, take the view of the corporations and the media that says, how are you going to pay for this? As if we're all sitting there with billions of dollars and we've got to worry about it. I think we need to raise the slogans and then say, you better start worrying about how you're going to pay for it, or you're not going to succeed at the next election. Let the others do the work. Let's raise those issues. Not that, of course, we shouldn't have the numbers and things like that also, but let's raise some issues and have people think about that.
All righty. Well, I first want to thank the panelists for being here tonight. And I, of course, want to thank everybody for coming. This will be aired on Channel 2 and will be edited a little bit by our fabulous Power Media team, who have learned how to run cameras and do editing, to produce our own media, which is, as we've heard, part of the problem. And I also want to call your attention to the healthcare surveys that are on your chairs. These are surveys that are designed to take a look at any healthcare violations that you have experienced or people you know have experienced. Antoinette back there, she'll wave, will collect your surveys. And she will also collect any donations that you have to give to Power. We are obviously nonprofit. We are low-income led. We have no paid staff, so any donations are very helpful. And we also are selling T-shirts back there that I'm modeling, and Alan over there, our cameraman, is modeling. We will be following up this healthcare organizing with a Healthcare Truth Commission in late April. It will be a time for people who've experienced healthcare problems, bankruptcy, lack of healthcare insurance, to come and speak to the community about these issues. It's really about people using their own stories to advocate for social change, create social movements, using their own voice, because your stories are important and they are important to us. And if you do not want to speak at the Truth Commission, you can still submit your story and we can do it anonymously for you. And we'll be getting more information out to you about the date and the time and the place and all that good stuff as soon as we have it. And if you would like to be more directly involved with Power, there's also membership cards back there that you can sign up. We have a sliding membership dues for zero to whatever, depending on your income. And our meetings are held the third Monday of every month. We have a new space, which is the Meg Perry Center, which is 644 Congress Street. So
It's not our space.
it's not our space, but we are renting a space to have our monthly meetings. And our next one is actually coming up this Monday, the 17th. Love to see you all there. It's at 6 p.m., 6 to 8. And actually, we'll hopefully have food and it'll be fun. So I think that's all we have for tonight. I, again, just want to thank everybody for coming, and please spread the word.
Okay, we're free, right?
So who's taking names and addresses?